My name is Subcutaneous and I'm going to start presenting section A, number 1 and 2 from the infographic. Pressure ulcer, or also known as pressure sores or bed sores, are injuries to the skin and underlying tissues and usually affect people who are bedridden or who sit in a chair or wheelchair for a long period of time. To code this particular condition, first we have to look at the code L89 pressure ulcer in tabular list and identify the site as well as the stages of the pressure ulcer. If the patient has more than one site, such as elbow, lower back, hip, buttocks, then we have to code each one of it with a priority on the severity. And remember to also look at the instruction on the tabular list. For example, code L89.13 pressure ulcer of right lower back, where it will classify into stage 1 to 4, pressure-induced deep tissue damage, unstageable and unspecified stages. Next, we need to distinguish between unstageable and unspecified stage. So for unstageable pressure ulcer, code in the same category, which is L89, will end with 6 character 0. And this stage should be based on clinical documentation when stage of the pressure ulcer cannot be clinically determined. And this is not the same as unspecified stage that ended with character 9, which are assigned when no documentation regarding the stage of pressure ulcer. And if during any encounter the unstageable stage revealed after debridement, assign only the particular code revealed after debridement.
Assalamualaikum, my name is Najwa Balkis and I will present the pressure ulcer number 3, 4 and 5 from the infographic. For the documented pressure ulcer stage, the stage of the pressure ulcer should be assigned based on the clinical documentation or terms found in the alphabetic index. If the documentation does not provide enough information about the stage, the provider should be queried. There is 4 stages in pressure ulcer. Stage 1, non-blanching erythema with intact epidermis. Stage 2, partial thickness ulcer involving epidermis and dermis. Stage 3, full thickness ulcer extending through dermis into subcutaneous tissue. And stage 4, deep tissue destruction extending through fascia and may involve muscle, bone and tendons. Next, there is no code assigned for patient with a pressure ulcer that is completely healed at the time of admission. Next situation, pressure ulcer documented as healing. A pressure ulcer that is described as healing should be assigned the appropriate stage code based on the documentation in the medical record. If the documentation does not provide enough information about the stage, you should assign the code for unspecified stage. For pressure ulcer that were present on admission but healed at the time of discharge, code for site and stage of the pressure ulcer at the time of admission should be assigned.
Assalamualaikum, my name is Nur Ashkin binti Slamat. I present for the next part. The next part, if the pressure ulcer patient admit to hospital at low stage, but during the stay in hospital, the pressure ulcer stage progress to the higher stage, therefore 2 separate code should be assigned. One code for the site and stage of the ulcer on admission, and the second code for the same ulcer site at the higher stage reported during the stay. For example, first code is L89.021 pressure ulcer of left elbow stage 1, and the second code should be L89.024 pressure ulcer of left elbow stage 4 as it progress to the higher stage during the stay. This code from L89 pressure ulcer cannot become as the PD, as the tabular list mentioned that coder should code first any associated gangrene from I96. Next, if a patient has pressure-induced deep tissue damage or deep tissue pressure injury, the coder need to assign only the appropriate code for pressure-induced deep tissue damage, L89.XX6. Note that the number 6 at the 6th character represent for pressure-induced deep tissue damage. For example, L89.216 is a pressure-induced deep tissue damage of right hip.
Assalamualaikum, my name is Siti Fariza Safira binti Sahibun. On this slide, I will explain on the guidelines to code for non-pressure ulcer. But first, I will explain briefly on what is non-pressure ulcer. A non-pressure ulcer is an open wound that develops on the skin caused by poor blood circulation or injury. Non-pressure ulcer can also progress to several stages. In the early stages, they may barely break the skin, and in the later stages, they can involve deep wounds and carry higher risk of complications. The category code for non-pressure ulcer is from L97 to L98. The first guideline is regarding the situation when patients are admitted with non-pressure ulcer that has been documented as healed. For this case, no code is assigned if the documentation states that the non-pressure ulcer is completely healed at the time of admission. This is because there is no treatment performed on the patients. Next situation is when the non-pressure ulcer are documented as healing. In this case, appropriate code should be assigned based on the documentation in the medical record. And if the documentation does not provide information about the severity of the healing non-pressure ulcer, appropriate code for the unspecified should be assigned. As for ulcers that were present on the admission but healed at the time of discharge, code for the size and severity of the non-pressure ulcer at the time of admission need to be assigned. Last but not least, if a patient is admitted to an inpatient hospital with a non-pressure ulcer at 1 severity and it progressed to a higher severity level, 2 separate codes should be assigned. One code is for the size and severity of the ulcer on admission, and another code for ulcer on the same site but with higher severity level reported during the day.